I'm Roger, and I live in Silicon Valley, California. One day I was on an airplane and I read about the Galleri test in a book, that there was such a test that could screen for 50 different cancers. I found Galleri online and they connected me with an independent healthcare provider that was able to provide a prescription to get the test. And the next thing you knew, they took my blood, and a week later I got my results. My telemedicine provider called me and informed me that they found a cancer signal with 2 predictive origins. And I remember thinking, please don't be pancreas. And he said, one is pancreatic gallbladder, and the other stomach esophagus, and you should do further testing. The next day I had an MRI that showed a mass on my pancreas, and fairly soon after that, I had a CT scan, and very soon after that, a biopsy, and it was within a few weeks that I had a diagnosis of pancreas cancer. One of the radiologists I talked to, he called me up only to tell me that I was the luckiest person he'd ever met. Because of where the cancer was and how it was growing, he said I never would have had symptoms. I never would have known about this until it was at a much more advanced stage. It's been hard on my daughter, and of course that was, when I got the official diagnosis, that was definitely my first thought. This is going to be hard on my daughter. But since then, my condition has improved. I'm currently no evidence of disease, so far so good. I thought I was doing everything a person needed to do to stay healthy, so I had no idea that I was at risk for cancer. That was the surprising part. The Galleri test found this for me really in the nick of time, is how I look at it. There would have been very little doctors could do for me if it had advanced just a little bit more. When I first got the diagnosis, my first thought was, I just want to stay alive long enough to see my daughter graduate high school. And it looks very likely I'm going to see her graduate college and probably beyond.
Based on a clinical study of people ages 50 to 79, around 1% are expected to receive a cancer signal detected result, which includes predicted cancer signal origins. After diagnostic evaluation, around 40% of people are expected to have a confirmed cancer diagnosis. The Galleri test is prescription only. It is not recommended in individuals who are pregnant, 21 years old or younger, or undergoing active cancer treatment. Galleri does not detect all cancers and should be used in addition to routine cancer screening. False positive and false negative results do occur.